there's so much to talk about here. RFK, USDA, nutrition, food, vaccines. Why don't you introduce yourself first?
Yeah, the quick life story is I grew up in Washington, D.C., wanted to be on campaigns, was on some Republican campaigns, and inevitably found myself as a lobbyist, which everyone does after campaigns. So I'm working with people across the aisle for food and pharma. And with food companies, I helped Coke pay off the NAACP to say that taking Coke off food stamps was racist. We paid conservative think tanks to say it was against freedom to deny children government-funded Coke. And then with pharma, learned the foundational incentive that the healthcare industry in this country, just as a statement of economic fact, makes money when people are sick. And capitalism is the greatest invention in human history, but this isn't capitalism. We have complete takeover where there's 5 lobbyists in pharma for every single member of Congress. And just fundamentally right now, healthcare is the largest and fastest growing industry in the country. That's not right. It's not AI, it's not tech, it's healthcare. And putting the pieces together, getting out of that, becoming an entrepreneur, being influenced by my sister, who is top of her class Stanford Med School.
She's an incredible person.
Top of her class Stanford Med School, was rising up the ranks, NIH researcher, head and neck surgeon, and she realized 12 years into training that she looked down at a patient and she did not understand why they were sick, that 90% of her course load at Stanford Medical School was on pharmacology because pharma pays 50% of Stanford Med School's budget, that she did not take one class on nutrition and actually realize why patients are sick. And she was told that serious medicine is a scalpel and a drug prescription pad after people get sick. And then tracing to putting the pieces together with my political experience with Casey, with seeing my mom abruptly die from pancreatic cancer after decades of missed warning signs, we kind of put it together. And right after my mom's death, we're like, this is the biggest issue in the world. We're debating trivia. I think it really, to me, ties to this key political dynamic in our country, which is fueling Donald Trump, which is fueling RFK, which is fueling populist uprisings throughout the world. But people can't quite put their finger on it, but something is against us right now. There are dark incentives against us.
Exactly right.
And what we are trying to say, and truly, we decided to devote our lives to this right after our mom died in 2021. We're like, we need to get this message out. And we need to start talking about, I think it's a way to channel actually this frustration people are feeling that can't quite put their finger on. And the way to channel corruption and the way to channel these forces that we all feel are against us is it's a great case study to look at our healthcare system where, again, a pharma company makes money when a kid gets sick. There is nothing better than a kid being obese.
No. But then, therefore, do they want people to get sick?
So let's get out of the conspiracies.
No, I'm not. I'm just saying, wouldn't it be logical if you make money when someone is sick? At the very least, are they indifferent to people getting sick?
As a statement of economic fact, our largest institution, which pharma is a big part of healthcare, wants people to get sick. Let's take a child. Let's take a child who has slightly high cholesterol. Statin prescriptions have doubled in the past 5 years among high schoolers.
Kids are on statins?
Oh,
what is
it's like candy. It's like candy.
But cholesterol's not a bad thing inherently.
Exactly. So instead of explaining that, and instead of the medical system trying to get that kid off of this treadmill of pharmaceuticals, we're prescribing statins, we're prescribing metformin, which has doubled in the past 5 years among high schoolers, and then antidepressants. You talk to any parent with high school kids, they're prescribed like candy.
Benzos,
Xanax, 100%.
Prozac, yeah.
And now the American Academy of Pediatrics, which is paid for by pharma, is saying Ozempic should be the first line defense for 12-year-olds, and they're doing studies on 6-year-olds. So if you're a parent with a high schooler and your kid's a little bit distracted, it's Adderall, of course. If your kid has slightly high cholesterol, it's statin. High blood sugar, metformin. Now if they're a little bit overweight, Ozempic. So the spiritual problem of this, where the healthcare system, which has bought off the academic research, which has bought off the politicians, which has bought off the levers of trust, they're saying it's just like COVID. You're anti-science unless you give that kid Ozempic, unless you give that kid a statin. And what's happening is absolute devastation among kids. I mean, 50% of teens are overweight or obese. It's 3% childhood obesity rate in Japan. 20% of teens have fatty liver disease. 40% of kids qualify as having a mental health disorder. This is all new, right? This is all just in the past.
When did it start to change?
You look at the graphs, it all started around 1990. And, just digging into the corruption, in 1990, the 2 largest food companies in the world were cigarette companies. So as the Surgeon General pushed the cigarette companies to, pushed against cigarettes, they used their cash piles in the 1980s to buy food companies. And Philip Morris and R.J. Reynolds created the ultra-processed food industry. It all traces to actually 1990. And they lobbied for the food pyramid. So the food pyramid was created by the cigarette companies. The two
hilariously, cigarettes kept us skinny.
Exactly. So they took on the cigarette.
I'm not pro-cigarette.
It would be healthier if the cigarette companies went back to making cigarettes. That actually is
for
true.
Sure.
They shifted their scientists to
Ironically,
make food.
we were a healthier country when we were smoking.
That's just factually true. You look at cancer rates; they've gone up orders of magnitude since the 1985 because cigarette companies shifted their scientists to food. That's what happened when they bought the food companies. They shifted all their scientists
from one addictive substance to another.
That they can sell to kids and everyone eats. So that ushered in the 1990s, the percentage with the food pyramid, which was an ultra-processed food marketing document, our diet flowed to ultra-processed food. And my point is not to lecture anyone what to eat or what to feed their children, but to educate and tell people, as RFK is saying, this is corporate capture. The USDA should not be paid for by the food industry to tell kids that we should be eating ultra-processed food and that's safe when they contain demonstrably harmful ingredients. That's corruption of science. It's corruption of the free market. And I think that's what we're starting to tap into.
Well, no, I mean, it would be like Marlboro donating to the American Lung Association.
Yeah, it'd be like Anheuser-Busch donating to Alcoholics Anonymous. It makes no sense. Yeah.
Which I don't know if they do or not. So is there any evidence that the cigarette companies going into food, that they had the intent to go into something addictive?
Oh, this is something I talk about a lot. They bought the rationale of buying food companies. Again, just to set the context, Philip Morris and R.J. Reynolds, now it's like Google and Microsoft, they were top 10 most valuable companies in the world in the 1980s, the biggest cash piles of any company in human history. So this is a documented shareholder education. We are going to buy food companies and we're going to use our scientists strategically to make food more palatable and make it more addictive. And then they were also going to use their lobbying power to buy off the USDA and the FDA. So the toxic stew that our children exist in right now, where the USDA to this day says a diet 92% in ultra-processed food can be healthy for kids. They recommend added sugar to 2-year-olds. I don't have any lecture to any parent what to feed their kids, but the USDA should not be recommending sugar to your 2-year-olds.
Where did the food pyramid come from?
It was a lobbying instrument from the cigarette industry about food companies. They very strategically paid the Sugar Research Council at Harvard to create research saying sugar doesn't cause obesity and that carbs were really important and that animal-based fats were vilified. This is research from Harvard. Everyone can look it up, the Sugar Research Council. They then use this research, and this is what I saw working for these industries. You pay off the Harvard researchers. It's like PR. It's like buying PR. They're coin operated. Then you take those studies saying sugar doesn't cause obesity and you slam that on the table of the regulators. The regulators are also paid by the food companies. So it creates, through a very strategic effort of using the Harvard research to influence the USDA, it creates the food pyramid, which said animal-based fats are bad, which said carbs are the center, sugar is the center. And Americans listen to medical authorities. We shifted our diet, 20% of our diet to carbs in the next 10 years. So and every parent who fed their kids this crap thought they were doing the right thing, because they were listening to the science. So that's how it works. It's co-option of our institutions.